Hello everybody, my name is Dr. Vandana Gawdi. I am a practicing consultant at Apollo Hospitals, Navi Mumbai. I'm an obstetrician and gynecologist practicing since about 30 years. Today I'm going to speak a little bit about breastfeeding. Many of you are looking forward to motherhood, and I'm sure every young or older pregnant lady is looking forward to a successful breastfeeding. To all of you, I would like to wish you very successful and a good, healthy bond with your child during breastfeeding. I still believe that breastfeeding is the best feeding. As you all know that there are many benefits to the mother and the child with breastfeeding. The first thing that is important to remember is that you need to have the right mindset for breastfeeding. It is important that you are looking forward to it, you are making an attempt, and it is a very simple process, but it can be very, it can be very stressful to new mothers who get very anxious. And to all you young mothers who are getting anxious about breastfeeding, let me assure you that it just requires a little bit of patience, a little bit of support, little help from family and friends, the nursing staff in the hospital where you deliver, your doctors under who you deliver, and every one of us can have a successful breastfeeding. The breast milk does not form immediately after birth, and if it is not sufficient or adequate for your child, I request you all and make you understand that there is nothing to worry about, because it takes a few hours, maybe 24 hours, sometimes 72 hours, for the breastfeeding to be completely established. In the intervening time, it is important, the important thing you must remember is put your child on the breast, encourage the baby to latch on, and the milk will become adequate at some point. Okay, so if you feel that you need help of breastfeeding consultants, it is a very important, a very important part of our antenatal care nowadays. We ask patients to go and meet a breastfeeding consultant who's going to prime you, who's going to help you to understand the different positions in which you can hold your baby, and to give you the importance of letting your baby latch on as early after birth as possible. Whether you are going to have a normal vaginal delivery or you're going to have a C-section birth, it is important that your baby latches onto the breast, and your doctors and your care providers will help you to do that. So why is it that we are so keen that you all start breastfeeding your baby? There are several benefits for breastfeeding. Okay, of course we all know that the most beautiful outcome of a successful breastfeeding is the bond that develops between the mother and child. But did you all know that there are so many health benefits too? Alright, so there are benefits to your child and there are benefits to you. The benefits to your child will be that a child who is exclusively breastfeeding versus a child who's on a top feed will have better bowel movements, less gas distension in the abdomen, because when the child is suckling milk through a bottle, the child also takes in a lot of air in the abdomen, and the stomach bloats, and those babies are more gassy and they tend to pass stools which are with a lot of flatulence. Whereas breastfed infants have softer bowels, they have less gas, and they usually the digestive system is better geared to digest the milk. The second benefit is that I don't know if many of you would know that a successful breastfeeding early after birth reduces the incidence of a physiological jaundice. We do know that the baby intrauterine has a very high hemoglobin content, but once the baby is out of the mother, the hemoglobin is broken down, because the level of hemoglobin in a child who is newborn is less than the hemoglobin of an intrauterine child. So as this hemoglobin breaks down, it releases the jaundice producing pigment which is known as bilirubin, and that can lead to physiological jaundice. But children who are breastfed at the early stage, the hepatic circulation, the circulation of blood in the liver is better, and therefore the liver functions more efficiently, and those are the kids who are less likely to have jaundice. The second is that when you have a prolonged breastfeeding, infants who are breastfed for a long time, their dental development is better, their jaw development is better, versus babies who were put on a top feed and had a silicone nipple, because the development of the jaw and the bones in the jawbone as well as the teeth are better with breastfed infants. What about the benefits to the mother? So of course there are, drawbacks. It's going to lead to lack of sleep. It's going to make you more tired. Of course, getting up in the middle of the night to breastfeed your baby 3 or 4 times is going to take a toll on anybody's sleep cycle. But just try to ask a woman. So your baby is going to be hungry every 2 hours or 3 hours in the night. Just ask a woman who actually has to make a top feed for the child in the night. And any day it is easier to breastfeed the baby versus giving the child a top feed. Okay, so though it is tiring, but it is still, of the 2 options, a breastfeeding is always more easy and convenient. It comes in sterile containers and there's not much preparation required. So it is a better option versus a top feed. The second benefit of breastfeeding is that it is the funny thing is it's going to help you to burn calories. So when you top feed your baby, you don't burn as many calories as when you breastfeed your child. So all you young mothers who are looking to lose the pregnancy fat, I'm sure that's a very big motivating factor, who are looking to lose fat faster, your pregnancy fat faster, I would encourage you to breastfeed your child as long as you can. The third benefit of breastfeeding is the longer you breastfeed, the more the glands are activated to produce milk, the less likely they are to develop breast cancer later on in life. Now, if that is not a motivation, I don't know what else could be the motivation. So, looking at all the benefits, I would certainly say that if you have to choose between breastfeeding and top feeding, all of you go for it. Don't worry about it. Do your best. Take your mindset that no matter how painful it is in the first couple of days after childbirth, your insides are raw, you probably have some stitches. If it's an episiotomy, if it's a normal delivery, there's an episiotomy, or there may be abdominal cut if it's a C-section. Pain is going to be there, but you young mothers, you can do it. And once you decide that you can do it, it's going to be good for you and your baby. Happy breastfeeding to all of you.